We are pleased to have Misty Baker, our Director of Compliance, presenting today. Misty began her career in the insurance industry in 1998 and worked as a benefit analyst before opening Lone Star Benefit Solutions as an independent agent. Prior to joining the team, Misty was the Director of Health Insurance Services with the Independent Insurance Agents of Texas and has a wealth of experience in ACA compliance. For more than 10 years, Misty has been a senior-level compliance and agent advocate, specializing in ACA, ERISA, FMLA, COBRA, and legislative advocacy. In 2015, Misty was awarded one of the most influential women in employee benefits advising by Employee Benefit Advisor. Misty joined the Benefit Mall team in September. In her current role, she partners with the insurance field sales team and services leaders and serves as an Affordable Care Act compliance resource to Benefit Mall's partners. Misty, thank you for joining us.
Good morning, everyone, and thank you so much for attending the webinar this morning. It's really hard to believe that we've had the Affordable Care Act in place for 6 years, and we're about to go in to our 4th open enrollment period. Most importantly, we thought that 2016 would be a quiet year for change, as most of the law's provisions were already implemented. Well, we may have thought wrong. On the other hand, when we track the issues that we talked about during our last webinar, we seem to predict well what we thought those issues might be. We plan on doing a quick year review for 2016 before we move on to see what's up for 2017. Let's look at today's topics. We're going to really focus in here on open enrollment and exchange performance and premium rate increases, carrier financial performance and consolidation, and really the future of employer-sponsored coverage. We're also going to look at current legislative initiatives and healthcare and what happens next. So regardless whether you're a fan of the Affordable Care Act or not, it's here to stay. The general public is still evenly split on their perceptions of the law with a slight negative tilt. Regardless of which side you may lean to, you can't help but admit that ACA has significantly changed the health insurance industry. While we have seen the Affordable Care Act bring about a number of positive impacts, beginning with the overall uninsured rate, now trending below 10%, and that's a significant drop over the last few years. Both federal and state exchanges have attracted more than 10 million enrollees, with 85% of those receiving government assistance tax credits, allowing many to be covered for the first time. Policies are now written on a guaranteed issue basis, and pre-existing conditions are a thing of the past. But not all is positive. There are still about 10 million Americans that remain uninsured, and although tax credits and subsidies assist those purchasing coverage, cost sharing in the form of high deductibles and co-payments are a deterrent to care for many, and rates for individual exchange products are beginning to spiral out of control. Before we look at 2017, let's just quickly discuss the ACA topics that helped shape our industry this past year. With most of the law already have been implemented, our focus on ACA turned from education and implementation to really studying outcomes and options. As this slide shows, one of the first topics we stayed focused on was the small group expansion. In 2016, the definition of small group was supposed to increase to up to 100 employees under the original provisions of ACA. But as 2016 came to a close, Congress passed the PACE Act, which repealed and mandated small group expansion, giving states the flexibility to determine the size of their small group market instead of being forced into a national standard. While the change was really welcomed by most, it caused tremendous confusion and significant workload for brokers and their clients. The next two topics we followed closely were the annual open enrollment period and the financial struggles of co-ops. Both of these will be discussed in greater detail throughout our webinar. Beginning in 2016, the employer mandated extended to all groups with greater than 50 FTEs or full-time equivalents after being delayed a year. These employers are now being required to make an offer of affordable coverage to 90% of all employees, and that's up from 70% that was in effect for 2015. But the most challenging employer-related topic was the onerous reporting requirements that went into effect for the first time. You probably spent the early part of the year working on data collection, filing issues with your clients, and many of you turning to Benefit Mall's own reporting service called All Compliance to assist you in these efforts. Like open enrollment and co-ops, we plan on discussing the issue of risk corridors when we explore this section on carrier financial performance a little later. Turning to commissions, 2016 went from bad to worse. Given the stringent MLR requirements placed on carriers under ACA, we saw a broad reduction in broker and agent compensation over the last few years. But when carrier losses on public exchange began to accelerate, many carriers stopped paying commission at all, especially on exchange plans, and especially those that were sold during special enrollment periods. We all know by now the Cadillac tax has been deferred to 2020, but there's still a major effort going on to repeal that provision entirely. With strong bipartisan support, this may be a reality after the election season concludes. And lastly, we were focused on the more than 60 repeal votes taken by the House and the political wrangling that continues to occur. Later in our webinar, we'll update you on the current legislative priorities and the most likely changes we'll see in 2017. So our outlook for 2017, really many of the topics that we'll report on are interrelated as well. Carrier losses and their desire to consolidate are driven by risk pools which are causing spiraling rate increases leading to challenges in the public exchanges. So let's start a discussion on our outlook for 2017, and let's start with the open enrollment topic. With less than 2 months to go before ACA's open enrollment period begins, the insurance carriers continue to experience significant losses and are seeking double-digit rate increases across the board. That's the good news. Things just got worse. Aetna is the latest national carrier to scale back their exchange offerings. Beginning in 2017, they will only operate in 4 states, exiting from 15 current states with more than 800,000 consumers being impacted. But Aetna wasn't the first major carrier to scale back and probably won't be the last. Recently, Oscar Insurance announced that they will exit both the New Jersey and Dallas-Fort Worth markets. Aetna's move was preceded by similar announcements both from United Healthcare and Humana. All of these carriers are losing hundreds of millions of dollars on their exchange business, with Aetna itself losing $200 million in just the second quarter of 2016. We'll do a deeper dive on what's driving these losses. As many of you are painfully aware, the exchanges run by states survive startup problems with botched technology and political threats, but continue to grapple with a fundamental challenge: financial sustainability. The $5 billion provided by the federal government is almost depleted, and in 13 states which administer their own exchanges are having a tough time raising enough money through user fees, state funding, and to maintain their operations. Premium increases and exchange troubles were the major topics of discussion at the August NAIC meeting. But as this year's open enrollment begins, millions will have one thing on their mind, and it's price. Once they get past the sticker shock, they're going to find fewer plans to choose from, higher deductibles, and cost-sharing and smaller provider networks. Research shows that people shopping in the marketplaces are overwhelmingly choosing the cheapest plan they can find. A recent federal analysis shows that in 2014, 2/3 of people went for the lowest cost or second lowest price plans in each of the rating tiers. In 2015, about half chose the cheapest plan. Healthy and young people who are essential to insurers to offset the cost of care for unhealthy people are regularly turning to whatever plan is cheapest, including those from little-known insurers or with the smallest networks of hospitals and doctors. But many other young and healthy people, particularly those not eligible for those subsidies, are shunning plans altogether, finding all of the prices just too high. And these consumers that are critical to balance of risk pools, yet tax penalties are still not effective deterrent as premiums skyrocket. For brokers, there may be some reason to be optimistic. With high individual rates, predictions that small groups would dump employees into individual exchanges are just not occurring. Employer participation is stable in a segment where the commissions are not as volatile or non-existent like they've been in the individual market. In many markets, carriers will also continue to offer individual plans off exchange. By law, it must be guaranteed issue and be the price same as the on-exchange plans. But these off-exchange plans are not subsidized and therefore will not attract a risk pool of higher income individuals. From an actuarial perspective, we know that there is a positive correlation of income with wellness that could improve future risk pools leading to lower rates. Really, the lack of choice for many consumers might be the most concerning. However, there could be a reason to expect that any remaining carriers might see a consolidation of enrollees, which may bring the law of large numbers to their advantage, resulting in a better cross-section of risk, leading to another opportunity for lower or at a minimum more stable rates. And while one would expect to have less competition would be counterintuitive to lower in pricing, there's a rigorous regulatory rate review process in place, and MLR limits will keep insurers in check. We've been talking for months about how high premiums might rise in 2017, but we never expected to see prices as high as what's been released. I guess the concept of Affordable Care Act is still a dream for many. Although not every state has been finalized yet, it appears an average increase will be well into double digits, and increases above 30% will not be common. In some states like North Carolina and Tennessee, carriers revise their rate request upward to reflect the impact caused by other carriers exiting the market. After careful review by regulators, they reluctantly are approving these huge rate increases as the financial data submitted by the carriers support their need. If you follow our blog at healthcareexchange.com, you already know the reasons for these increases are focused around a number of key issues. Those are really pharmaceutical companies bringing new and more expensive products to the markets, rising hospital costs, more technology for complex treatments. Also, the expiration of ACA's risk adjustment programs that were implemented to assist insurance carriers with patient-specific catastrophic illnesses to help subsidize a carrier's total risk pool. Also, an inadequacy of current premiums. So let's face the facts. Health insurance is expensive because health care is expensive. In 2017, the Obama administration projected the national spending on health care will average more than $10,000 a person. Further, they expect by the year 2025, health care will represent 20% of the total economy, up from 17.8% in 2015. Medicare is expected to spend about $18,000 a year for each participant in 2025, an increase from $12,000 per year they spend today. Overall spending in sectors is expected to increase throughout 2025 at 5.7 to 6% annually. While the reason we state above our specific health exchange premium increases, there are other things that are driving up underlying costs. Ironically, an improving economy is a major driver of increased costs. As income rises, consumers often spend more on health goods and services. There's still some reason to remain optimistic. Some believe that in 2017, a premium increases might simply be indicative of a market correction. Both Clinton and Trump have introduced ideas to fix the system, and we're going to talk about that a little bit later. On September 1st, HHS Secretary Burwell made a number of public comments staying optimistic about future of exchanges. She indicated that with the administrative tools they have, like the exchanges, they're sustainable even without legislative fixes, and that they already have been making changes on their own to improve the situation for insurers, such as limiting special enrollment periods and making changes to the risk adjustment program. All of these issues that we're talking about today with regards to our outlook for 2017 are intertwined. Carrier losses and exchange challenges cannot be looked at in a vacuum. You need to add the conversation premium rate increases as you'll see in a moment under carrier consolidation. Only about 1/3 of health insurers came out ahead in their first year in the Obamacare marketplaces, according to a recent study by the Commonwealth Fund. Overall, health insurers underestimated their total medical costs by about 5.7% their first year. About 1/4 of insurers did substantially worse, underestimating their claims by an average of 35%. The law was supposed to help carriers recoup some of that money lost from the Obamacare plans with the help of the law's reinsurance payments. But losses were so significant that few carriers had the money to contribute into those funds, so those payments couldn't be made. This program is ending in 2017. So these carriers persevered through the early challenges of ACA, particularly constantly changing rules, political and legal uncertainty, and botched technology. But in addition to the financial challenges facing insurance carriers, the 13 states that administer their own state exchanges must be financially self-sustaining in 2017. A task that is nearly impossible as enrollment continues to be significantly short of expectations to fund the infrastructure that each of these states have built. Many early critics of ACA predicted the losses that these carriers are now experiencing and are driven by a combination of factors. Most notably, exchanges are not attracting the number of total consumers that they were expected to, especially younger and healthier enrollees. Also, carriers have initially underpriced their products to attract those early market share gains. The large rate increases they now require are partially a function of their initial pricing strategy as they now play catch-up to match current costs. Some fear that significant increases will lead to further disenrollment, also leading into this death spiral. Also, rate stabilization funds are insufficient to offset the loss experienced by many carriers, as financial pools for carriers that experience gains are virtually non-existent. And those losses are just not occurring among national carriers. In fact, the small regional carriers may be suffering the most. Of the original 23 health insurance co-ops that were formed under ACA, 16 are already insolvent. As for the remaining 7, most simply feel that it's a matter of when, not if, they cease doing business. But there's still a hardcore group of supporters that are very much in denial. Obama administration officials have recently argued that these carrier exits are not a sign that Obamacare is in trouble. We also see that huge rate increases, carrier losses, and a challenging exchange environment. All that's good news. All of these issues combined lead to an ultimate outcome that has caused carriers to initiate consolidation amongst themselves. Most often cited reasons for consolidation is the need to manage the cost drivers that negatively impact affordability for consumers. Carriers believe that if they were larger in size, they could negotiate better reimbursement rates with the medical providers. Most of them follow these consolidations is a merger of Aetna with Humana and Anthem with Cigna. Both of these were announced in 2015 and have yet to close. In fact, both have been blocked by the Department of Justice and lawsuits are pending. Aetna's acquisition of Humana has been valued at $37 billion. In an effort to get some U.S. antitrust regulators to approve the deal, both companies have agreed to sell some of their assets to Molina Healthcare for a price of $117 million. Despite the offer to divest assets, the Department of Justice sued 2 months ago to block the merger. The DOJ is skeptical that these divestitures can maintain competition in the health insurance market. Cigna has an agreement to be acquired by Anthem for $48 billion, though the transaction is also being blocked by the Department of Justice on antitrust grounds. Both of these mergers are now going to be fought in court. Anthem is pushing for a speedy decision, but the government doesn't want that and are trying to slow play any rulings, stating that the case is just too complex to rush. The Department of Justice is concerned that these two deals would reduce the number of major American health insurance companies from 5 to 3, resulting in increased cost and reduced competition. There are pros and cons to mergers. These mergers will see these carriers capitalize on each other's strengths and use their size to reduce the cost of care, hopefully resulting in reduced premiums. While critics are concerned that their savings would not be passed on to consumers, with ACA's medical loss ratio provisions protect consumers by limiting the carrier's expenses and profits. Anthem will go to trial in the U.S. in late November. Expected it to be concluded by the end of December. A January ruling should follow. The Aetna case is scheduled to go to trial on December 5th. History is on the side of the Department of Justice, but both Anthem and Aetna said they will vigorously defend their mergers. So what happens if the Department of Justice prevails? One outcome may have these carriers creating a cohesive system that encourages hospitals, doctors, and insurers working together. Another outcome is that consolidation of smaller players that won't run afoul of the Justice Department. Both Aetna and Cigna might look at logical targets such as Molina Healthcare and WellCare. Universal American Corp, which specializes in Medicare Advantage and accountable care organization, and Magellan Health, a managed care company with large pharmacy benefits arm, they could also become pretty easy targets as well. So let's finish this section on a high note. Raising premiums, smaller networks, fewer choices. So where really is the silver lining for us? The good news is that small employer-sponsored coverage continues to be robust and is experiencing growth in numbers. In our last webinar, we talked about the future of employer-sponsored coverage, especially after the passage of the Affordable Care Act. Many experts predicted employers would opt out of those offering health insurance. The thought was that they would be focusing instead on providing defined contribution programs and would direct employees to individual health insurance and the public market. Some predicted this decline could be as much as 90% of the small employer market. Well, most recent study on the topic, however, has been conducted by the American Policy Institute. While they predict that employer-sponsored health care coverage will remain stable for the foreseeable future, they do warn that critical changes are needed so that employers receive the best care and to further protect them from spiraling cost hikes. Employers recognize that health coverage helps attract employees and that the increasing use of wellness initiatives also helps to keep them healthy and productive on the job. It may be that these wellness initiatives are the only probable near-term solution to help keep spiraling healthcare premiums on track. Benefit Mall continues to be a strong proponent of the legislative work performed by the National Association of Health Underwriters, and many of our sales professionals around the country actively participate in national, state, and local leadership positions. Really, the next two slides will detail our mutual legislative priorities. The legislative priorities that we'll track and report on throughout 2017 using our blogs and social media are protecting the role of agents and brokers, protecting that agents and brokers can participate in exchanges, employer-sponsored coverage, the health insurance or HIT tax, market reforms, healthcare affordability, Medicare, and long-term care. Each of these issues are important to all brokers and agents for a responsible, accessible, and affordable healthcare system for all Americans. Since our inception, Benefit Mall has been a broker-centric organization, and our top priority is protecting the role of brokers and agents. The ACA's medical loss provision has been one of the most crippling to the financial security of brokers nationwide. It's critical that this provision be changed so that consumers can continue to have access to professional, independent health insurance agents and brokers. Closely tied to protecting the role of brokers and ensuring that brokers and agents continue to participate in exchanges. Many carriers have stopped paying commissions in the individual market, and we believe that modifications to ACA could help improve risk pools, leading to better carrier financial results. At that point, commissions must be introduced to ensure an efficient distribution and service system. The employer mandate is a key component of ACA, but our employers are hindered by the onerous and time-consuming notice, compliance, and reporting requirements. We fully support a simplification of these requirements in order to ensure that employers continue to invest in their employees' health care needs in the year ahead. The ACA imposes a health insurance fee on health insurance company, also known as the HIT tax. This fee ultimately is a pass-through fee onto consumers, and it really increases the cost of health care for millions of Americans. We support legislation that would fully repeal or delay the tax. Market reforms and affordability are interrelated. The right reforms to an existing law can help improve on the overall cost of health care by making sure that consumers have incentives to maintain coverage. On the other hand, the greatest access barrier to health insurance coverage in America today is cost. Constraining skyrocketing medical costs is the most critical aspect of health care reform. The cost of health insurance delivery is the key driver in raising health insurance premiums, and it's putting the cost of health insurance coverage beyond the reach of many Americans. Our last two priorities are Medicare and long-term care. Congress should not limit the ability of seniors to access any Medicare option coverage, nor should they restrict senior access to the services of licensed professional health insurance producers. We also promote the idea that more individuals should privately finance their long-term care needs through appropriate long-term care plans, resulting in cost savings to both federal government and states in reduced Medicaid expenditures, as Medicaid is currently the primary payer of long-term expenses. One simple change to federal law that would have far-reaching benefits would be to include long-term care insurance premiums in Section 125 plans. This would encourage employers to offer coverage to their workers as either a voluntary or a subsidized benefit. Consistent with the priorities we just outlined, this slide shows the specific initiatives and key federal legislation that we are tracking. We oppose any effort that would eliminate the tax the employer tax exclusion for health insurance. H.R. 815 and S. 1661 are pieces of legislation that will remove agent and broker compensation for the MLR requirements for individual and small group coverage. These bills have strong bipartisan support, and we're cautiously optimistic. While the Cadillac tax has been delayed to 2020, we are working to repeal it in its entirety. Another piece of legislation with strong bipartisan support is repealing the 30-hour threshold that defines a full-time employee for the purposes of the employer mandate and would replace it to 40 hours. We continue to work with NAHU and others to repeal the annual fee on health insurance providers. Also impacted by the ACA were changes to the Medicare open enrollment period. We want to see these changes repealed and the original time frames reinstated. Finally, as outlined on the previous slide, we fully support legislation to stream the process of employer reporting process and strengthen the eligibility verification process for the health care premium tax and cost-sharing subsidies. Our last legislative topic before we move on to Colorado's Amendment 69. This amendment on November 8th general election ballot would establish a state-run health care system at a very high price, $25 billion in the first year alone. The consequences of this amendment are far-reaching. Because private insurance, Medicaid, and workmen's compensation would go away, Colorado's insurance industry would undergo a massive loss of jobs. Companies may not choose to relocate to Colorado because it's simply too expensive. Existing companies may move out of the state to save on taxes so they can provide proven, trusted health care benefits to their employees. National companies with Colorado locations may decide it's too much trouble to navigate multiple health care systems and make exceptions for their employees in Colorado. Workers and their families may relocate when they lose reliable coverage in favor of an untested state-run health plan. And quality doctors and other health care providers faced with lower reimbursements typical of government programs will flee Colorado. Future medical professionals would go elsewhere to establish their practices. While New York is looking at a similar plan, Colorado is the only one that has an active referendum come November. And while the impact here addresses just Colorado, imagine if such legislation begins to spread to additional states. We ask that you support us and Colorado's business leaders in denouncing this amendment. Talking about legislation is always a great segue into a discussion of politics. Let's start this last section of our webinar with a look at a recent tracking poll by Kaiser Family Foundation, followed by a comparison of Clinton and Trump's plans on health care and the Affordable Care Act. We're going to conclude with a crystal ball outlook on what might occur in November as well. The next few slides show us the results from a recent Kaiser Family Foundation survey that was focused on the role of healthcare issues in 2016. This is for the presidential election. And really with the election only a few weeks away, let's take a few minutes to talk about those issues that are foremost on the minds of consumers. Unlike in previous elections, healthcare is not at the top of the list. In fact, it falls fifth behind a candidate's personal characteristics, national security, gun control, and the economy. I'm not sure that consumers are finding that healthcare is any less important than in the past. Instead, with this being a rather unique election cycle, consumers are now more attuned to many other issues that really concern them. This slide looks at the same issues but displays them by party affiliation. Of the factors that are important to voters, there are noticeably party differences. Nearly two-thirds, or 63% of voters who identify as Republicans say terrorism and national security is extremely important to their vote, compared to 40% of voters who identify as Democrats and 43% of independent. The top issues for Democratic voters are education at 46%, health care at 42%. Among independent voters, terrorism and national security is a top issue. That's at 43%, but a larger share of independents say that a candidate's personal characteristic is important than someone who says the same about any other substantial policy issues. Let's turn specifically to health care. 85% of Republican voters and 93% of Democratic voters say their own political party best represents their views on health care. Independents are much more closely divided, with 4 in 10, or 39%, saying the Democratic Party best represents their health care views, and 1/3 say that the Republican Party represents their views. When asked which political party they trust to do a better job dealing with a series of health care issues, a larger share of voters said they trust the Democratic Party to do a better job than the Republican Party. Moving away from party affiliation to a view of the candidates, when asked which presidential candidate best represents their own views on health care, nearly half of the voters chose Hillary Clinton, while about 1/3 say Donald Trump. As expected, a vast majority of Democratic voters say Hillary Clinton is the best represents their views on health care, while only 3% say Donald Trump. On the other side of the political spectrum, 3/4 of Republican voters say Donald Trump best represents their own views on health care, while 1 in 10 say Hillary Clinton and 13% say neither candidate represents their views. More independent voters say Hillary Clinton best represents their health care views than Donald Trump, 39 compared to 30%, yet 1 in 4 say neither candidate represents their health care views. This slide shows a tracking survey that began in 2012, and this measures the public's view of the Affordable Care Act. While ACA remains a top health care issue for Republican voters, overall attitudes towards the law has begun to trend negative. The most recent survey finds 40% of Americans reporting favorable opinions of health care law and 46% reporting unfavorable opinions. This is really reversing a trend from about mid-2015. As the election day rapidly approaches, the healthcare industry is again looking to the major party candidates for what changes they might be able to expect. The good news is that if you're happy with the current system, you may only see a few changes regardless of what party occupies the White House come January. The Republican Party mantra of repeal and replace has been loud and clear for many years, but the truth is repeal is not really an option. It plays well among the core group of voters, but the reality is ACA has touched far too many Americans to simply repeal it without a significant disruption to the more than 26 million people that have benefited so far. The Affordable Care Act has resulted in a number of uninsured Americans dropping to 9% from 15% in 2011, while the number of employer-based coverage remains stable. With more than 60 House repeal votes, one of the more comprehensive replacement bills when it was introduced this past spring by Representative Pete Sessions from Texas and Senator Bill Cassidy from Louisiana. This effort was followed a short time later with the Republican Party officially plan titled A Better Way and was heralded as a real plan in black and white to make health care actually affordable. But the Republican plan is not Donald Trump's plan. Yes, there are a number of similarities, but nothing about the Trump candidacy to date has been predictable. Trump is outspoken about the fact that ACA was passed by bipartisan votes in the House and the Senate and signed into law by what he described as the most divisive and partisan president in American history. He's promised that on day one of his administration, he will ask Congress to immediately deliver a full repeal of Obamacare and work with Congress to make sure there are a series of reforms ready for implementation that follow free market principles that will restore economic freedom and certainty to everyone in this country. Trump's 7-point plan proposes the following: complete repeal of Obamacare, enables the sale of health insurance across state lines, allows individuals to fully deduct health insurance premium payments for their tax returns under the current tax system, and allows individuals to use HSAs, requires price transparency from all healthcare providers, provides Medicaid block grants to states, and removes barriers to entry into free markets for drug providers that offer safe, reliable, and cheaper products. There are many parallels among Trump's plan with the Republican plan, with a few, if any, differences. But the plan itself has no new ideas. The plans cobbled together a collection of well-worn Republican proposals that have been floating around for years, such as high-risk pools for consumers with pre-existing conditions, the purchase of insurance, purchasing insurance across state lines, Medicare block grants, expanding HSAs, and tax credits being exchanged for tax deductibility. And both plans, while broad, have a number of reforms that are good for Americans. Buying insurance across state lines, while may be an uphill climb given that insurance is still mostly state regulated, could bring new competitors, providing more choice, larger risk pools, and hopefully more moderate price increases. The ability to look to other countries for drug products could also be a major boost to stemming their costs, while block grants from Medicaid could help reduce waste caused by federal overregulation at the state level. But there might be a downside to the plans. The Trump plan is silent, with no mention of consumers with pre-existing conditions. The immediate fate of up to 26 million Americans is unknown among those who have found coverage through state and public exchanges or Medicaid expansion, creating a potentially disruptive situation for many. And, while buying coverage across state lines has obvious advantages, it could also create its own unintended consequences, just as reducing the number of rating bands and other reforms under the original ACA legislation, average premium cost, creating price increases for half the population. Crossing state lines would do about the same. From the very beginning of her campaign, Hillary Clinton stated that she fully supported the Affordable Care Act and would bring her administration recommendations that they would only improve on the current legislation. It's no surprise that when the Democratic Party adopted their platform in 2016, there were only a few policy provisions related to health care. Instead, making it into the platform was a number of ideas proposed by the campaign of Bernie Sanders as a way to secure his endorsement in advance of the convention. The most progressive issues in the Democrats' platform is the support of a public option in ACA exchanges and calls for those Americans who are 55 and older to be able to opt into Medicare. The platform encourages states to use the existing laws, innovation waivers, to develop local approaches to health coverage, enabling even more Americans to find affordable coverage. While their platform states that securing universal health care is a right and not a privilege, it stops just short of calling for a single-payer system, since the platform committee rejected the proposal by a vote of 92 to 62. If this is such a controversial topic among Democrats, it would never be embraced by the full Congress. Instead, the focus turning to a public option and Medicare expansion as ways to appease the single-payer proponents. One of the most entertaining things I often do is to log on to a website run by Larry Sabato of the University of Virginia Center for Politics. This site features detailed and frequently updated analysis for elections across the country. The crystal ball, as it's known, keeps up-to-date projections on the presidential election with every state and gubernatorial race, as well as the tight races for House seats. As this graphic shows, the presidential campaign is most likely an electoral landslide victory for Clinton. But with a few key states, it could be an interesting race. But this election is not just about the presidency. Republicans today hold a majority in both Senate and House, which has caused many stalemate during Obama's second term. And according to the crystal ball here, House Democrats are projected to gain seats, well short of the 30 needed to regain control. The Senate's a toss-up. We see Democrats holding 47 seats and the same for Republicans. 6 seats are really a toss-up. Whomever is the next president, they could be faced with a split Congress, making any progress on major issues that much more elusive. Despite the Affordable Care Act being more than 5 years old, there's still plenty of drama and concern. When this December comes around, we'll have a new president-elect, and we can expect even more change. Despite 26 million benefiting from the law, it doesn't make it any more popular, as we just saw. Yet the number of uninsured Americans is at historical lows. We predict that regardless of how the presidential elections play out, group insurance will remain robust with only an upside for brokers and agents. Individual coverage will continue to be challenged by the escalating premiums, but access should not be at risk. Broker commissions will likely never return to pre-Affordable Care Act levels, and as long as carriers continue to steer away from exchanges, any commissions among these higher risk groups will remain elusive. The biggest threat of all is affordability. Health insurance is expensive because health care is expensive, and small risk pools among dwindling exchanges are exacerbating this issue. We know that the Affordable Care Act has had a contributory inflation effect on premiums with little opportunity to reduce overall cost of insurance. Among the most probable near-term solution to reducing costs are the industry's drive towards wellness solutions, and having Republicans explicitly make this part of their plan is encouraging. Cost containment can no longer be regulated to increase deductibles and cost sharing. There has to be an increased personal accountability through individual wellness commitments and drive really to results. I want to thank you so much for your time today. Thank you so much for your business with Benefit Mall. Continue to look to us for additional webinars in the future and additional compliance resources in the future. Thank you and have a fantastic day.